In this section, we will cover another important workplace hazard during the pandemic, which includes workplace exposures to chemicals, specifically disinfectants. The COVID-19 pandemic has called for an increased use of disinfectants worldwide, both in public and private facilities, including in hospitals and nursing homes, in order to mitigate the virus burden. What is a disinfectant? Well, a disinfectant is defined by the U.S. Environmental Protection Agency, or EPA, as a substance or mixture of substances that can destroy or irreversibly inactivate bacteria, fungi, and viruses, but not necessarily bacterial spores, in an inanimate environment. Now, the EPA registers 3 types of disinfectants based on the type of efficacy data that's submitted by manufacturers. The 3 types include limited, general or broad spectrum, and hospital disinfectants. So those registered for limited use are meant to be effective against only a specific major group of microorganisms, such as Staphylococcus aureus or Salmonella. The general or broad spectrum disinfectants are meant to be effective against both gram-positive and gram-negative bacteria. They have a wide variety of uses in residential, commercial, and institutional sites. And lastly, hospital disinfectants are general or broad spectrum disinfectants that are also effective against the nosocomial bacteria pathogen Pseudomonas aeruginosa. These are disinfectants that are generally used in hospitals, clinics, dental offices, or other healthcare-related facilities. So during the pandemic, you may have heard a lot about EPA's List N, which consumers could use to search for disinfectants. However, it's important to note that products on this list have not been individually tested for efficacy. They are generally assumed to work since they kill similar or harder to kill viruses. They also do not necessarily meet EPA's Safer Choice, as well as the Design for the Environment labels, which are certifications for safer products. In addition, the long-term human health effects of a lot of the disinfectants listed on this EPA's List N remain largely unknown. Now, there are several main classes of active ingredients used in disinfectants, and these include quaternary ammonium compounds, also referred to as quats, bleach or sodium hypochlorite, peroxides, chlorine dioxide, hypochlorous acid, hydrochloric acid, phenols, and others that you see here on the list. These chemicals might be used either on their own or in combination to kill or inactivate a variety of microorganisms. Of these active ingredients, the top 3 are the most commonly used, as they're intended to be effective against a broad range of pathogenic microorganisms with adequate concentration and contact time. Now, human exposure to disinfectants may occur via inhalation, as well as indirect or direct ingestion and dermal absorption. The total exposure and relative contribution of each exposure route can vary considerably among the disinfectants based on the mode of application. These compounds can have an impact in the environment, as it has been shown that there can be uptake by plants and animals. Specifically, discharge into wastewater may cause adverse impacts on aquatic ecosystems, accumulation and vegetation, as well as contamination of the food chain via wastewater irrigation and sludge application. So the disinfectant application method can influence a person's uptake and risk of adverse effects. There are a variety of ways to apply disinfectants. These methods can range from manual application with trigger spray bottles to more technologically advanced techniques such as large mechanical sprayers and electrostatic sprayers. Electrostatic sprayers work by charging the antimicrobial liquid as it passes through a nozzle. Essentially, the positively charged antimicrobial droplets are attracted to negatively charged environmental surfaces, allowing for improved coverage on hard, non-porous environmental surfaces. Another application method includes foggers, which are also known as misters. These use a fan and a liquid solution to create a fog, or essentially an aerosol with small droplets, or a mist. The application technique for disinfectants used depends on many factors, including the type of setting, target surfaces, the intended purpose, the size of the room or number of surfaces to be treated, as well as the presence of other occupants. Manufacturers of disinfectant products are required to provide clear usage and safety instructions to maximize the effectiveness of disinfection, while also minimizing harm to users and occupants, although these are often not necessarily always adhered to by those who are using these products. As disinfectants have been shown to be associated with adverse respiratory health impacts, application of disinfectants via sprays might facilitate respiratory exposure to airborne particles. Liquid disinfectants may also volatilize, and it depends on the surface being treated, the dilution concentration used, as well as the ambient temperature. The size of the particles dispersed also differs by different application methods. For example, electrostatic sprayers and disinfectant foggers or misters typically produce smaller droplets compared to handheld trigger sprayers. Many factors, including aerosol size, shape, density, surface characteristics, and evaporation rate, dictate how long aerosols stay airborne and where the aerosols eventually deposit in the respiratory tract. In particular, disinfectant fogging machines or misters might be problematic for occupants as the small droplets are able to linger in the air for a prolonged period of time. In fact, the CDC does not recommend disinfectant fogging using older machines which use chemicals such as formaldehyde, phenol-based agents, or quats, which we spoke about briefly earlier, due to the ineffectiveness and adverse health effects on workers and other occupants. The safety of newer fogging technologies using chemicals such as ozone and vaporized hydrogen peroxide is still being investigated. So now we'll go over some of the potential human health effects that are associated with disinfectants. Acute health effects may occur from misuse and overuse, and chronic effects may be due to long-term exposure to certain chemical ingredients in these products, whether alone or in combination. For acute effects, misuse may occur from the improper preparation of disinfectant solutions and the improper mixing of sodium chloride with other products containing ammonia or acids. Users may be exposed to an excessive concentration of the disinfectant or dangerous byproducts as a result of chemical reactions caused by improper mixing of the products. Overuse of disinfectants includes the excessive use of disinfectants over the recommended frequency, which may lead to overexposure and acute adverse reactions, as well as chronic health impacts. Some of the acute effects reported from the misuse or overuse of disinfectants include coughing, shortness of breath, wheezing, chest pain, nausea, respiratory tract irritation, as well as fluid in the lungs and even death. Death may occur from high levels of chlorine gas, which is produced when sodium hypochlorite or bleach is combined with acids that may be found in other products, including cleaning products. Now, regarding the long-term health risks associated with exposure to disinfectants, most of the literature has focused on respiratory effects. Prior to the COVID-19 pandemic, studies already showed that the use of both cleaning agents and disinfectants in the workplace, including in healthcare settings, were linked with adverse acute effects, including respiratory health risks. In a study of over 70,000 nurses participating in the Nurses' Health Study from 2009 to 2015, researchers found that there was a 25 to 38% increased risk of chronic obstructive pulmonary disease, or COPD, among nurses, and that these increased risks were independent of asthma and smoking status. For context, workplace exposures are important causes of COPD. It is estimated that workplace exposures contribute to about 14% of all COPD cases and about 31% of cases among individuals who have never smoked. COPD also costs the U.S. about $50 billion each year, resulting from various disease-related expenditures, including healthcare costs and lost workdays. Chronic health risks may result from prolonged use alone or in combination with other cleaning agents. Many of the cleaning agents used may also contain several chemical ingredients like fragrances and other sensitizers, which may impact respiratory health. In addition, chemical byproducts may also be formed when improperly mixed, such as chloramines and chloroform, which is a known carcinogen. There is also some evidence that workplace exposures to disinfectant products may increase risk of other respiratory-related effects and obstructive respiratory diseases, including asthma onset and incidence, asthma exacerbation, as well as rhinitis. For example, some studies show that exposure to disinfectants may increase the risk of asthma in both professional and non-professional users, and this includes new onset among cleaning staff and healthcare professionals. However, less is known about non-respiratory-related health risks, although there is some emerging evidence that quats can alter or mimic hormone function in the body. In other words, they might be endocrine disruptors, and emerging findings from rodent studies suggest that exposure to quats may also impact reproductive health. This includes causing decreased fertility and increased birth defects. In fact, these findings were first noted by a researcher that noted that when a disinfectant containing quats was used to clean out the cages of mice, the fertility of the mice declined significantly, and birth defects in those mice that were born increased. Follow-up studies in rodents have shown that quads are linked with lower sperm concentrations, decreased sperm motility, as well as disrupted ovulation and increased rates of neural tube defects in offspring. So vulnerable populations at an increased risk of disinfectant exposures and potential health risk in this workforce include pretty much everyone in the healthcare industry, including healthcare workers. This includes your doctors, your nurses, your technicians, but especially healthcare service workers, which include your cleaning staff, as well as food services staff. In addition to individuals with pre-existing respiratory conditions that may be exacerbated with exposures, as well as older and pregnant workers. Now, misuse and overuse during the pandemic also led to a sharp increase in the use of cleaners and disinfectants that were accompanied by some negative consequences. As observed in these graphs, U.S. data from the National Poison Data System showed a sharp increase in the daily number of calls to poison information centers concerning cleaning and disinfection products beginning in March of 2020 compared to data from 2018 and 2019. In fact, the COVID-19 pandemic led to a severe shortage in personal protective equipment, or PPE, which also contributed to the misuse and overuse of disinfectants among essential workers in the healthcare industry. For example, at St. Catherine of Siena Medical Center, a hospital in Long Island, New York, healthcare workers reported spraying their reusable gowns with the disinfectant that was marketed for hard, inanimate, non-porous surfaces, such as floors and walls. So another instance of potential overexposure occurred in Colorado, where healthcare workers reported wiping down their face shields so frequently with the disinfectant that they became opaque. And in Vancouver, Washington, healthcare workers reported wiping both the inside and the outside of their powered air purifying respirators every time they left a potentially COVID-positive patient's room with hospital-grade disinfectants. One nurse noticed that the labels for these disinfectants included warnings such as harmful if inhaled or absorbed through the skin, and do not get in the eyes or on clothing, and became very concerned. In fact, many of the workers that were using this disinfectant began to complain about headaches, respiratory tract irritation, and fatigue. Now, the CDC and the National Institutes of Occupational Safety and Health, or NIOSH, do offer guidance for healthcare practitioners reusing PPE when there is a severe shortage. And this includes disinfecting face shields with federally registered hospital disinfectants. They do specify cleaning the outside of the face shield or goggles with hospital-grade disinfectants. Again, in prior cases, people were using them both inside and outside of face shields. However, most of the products that were being used to disinfect surfaces contain quats as active ingredients, which can also release formaldehyde. And as noted in previous slides, there are concerns related to respiratory and reproductive health. While misuse and overuse was a huge concern for those in direct patient care jobs, the healthcare service sector, including those working in housekeeping, are continually being ignored, even though they have been identified as one of the top occupational groups most affected by disinfectants. It is actually estimated that there are over 300,000 housekeepers employed in hospitals and nursing home facilities. There is no question that their work is valuable and vital for disease prevention and control in these facilities. Cleaning staff in hospitals can spend an average of 10 to 20 minutes a day per patient room. The published literature also shows a pattern of interactions between housekeepers and patients, and that they believe themselves to be a part of the patient care team. This is important not only from the perspective of potential contact with infectious agents and exposure to disinfectants, but also as it relates to mental health, given their interactions with patients. They are also at a higher risk of virus infection than nurses in the ICU, based on the number of patient rooms they visit during their shifts. So in summary, pandemics can impact the health of the healthcare workforce, and we have to keep in mind that the majority of this workforce is comprised of women, as well as low-wage jobs that are held by women, populations of color, as well as immigrants. Major workplace hazards of concern during and post-pandemics include mental health as well as chemical exposures, specifically the misuse or overuse, which poses serious concerns. Disinfectants can contain chemicals linked to both acute and chronic respiratory health risks. In addition, we have to keep in mind that vulnerable and invisible populations at risk of high exposures to disinfectants, especially cleaning staff, who again consist of majority women, populations of color, and immigrants, and are also low-wage workers, they're often forgotten despite their essential roles. So dismantling structural and systemic barriers is vital to mitigate health inequities that may result as a result of mental health and chemical workplace exposures. So as we move forward, it is critical that we work towards dismantling structural and systemic barriers, as this is vital to mitigate health inequities in these vulnerable worker populations that can arise from major workplace hazards, including those that can impact mental health and workplace exposures.